Aphorism 222. But such a patient who has recovered from an acute mental or emotional disease by the use of these non antipsychotic medicines should never be regarded as cured. On the contrary, no time should be lost in attempting to free him completely by means of a prolonged antipsychotic treatment from the chronic miasm of the soras sora, which it is true has now become once more latent, but is quite remedy to break out anew. If this be done, there is no fear of another similar attack if he attend faithfully to the diet and regimen prescribed from him. Explanation. In this aphorism, Dr. Henneman has given idea about acute mental disease. But when the patient has recovered from an acute mental or emotional disease by the use of these non-antipsychotic medicine, then such a patient should not be regarded as cured. On the contrary, without wasting any time, we should take efforts to get him free of disease. He should be treated by prolonged antipsychotic treatment from chronic sora. It is true that after acute attack subside, sora now has become latent again and it is ready to break out a new set of symptoms. But if patient is treated with antipsychotic remedies, there is no fear of another similar attack if patient follow the diet and regimen prescribed for him. Footnote 123. It very rarely happens that a mental or emotional disease of long standing ceases spontaneously, for the internal dyscrasia transfers itself again to the grosser corporeal organs. Such are the few cases met with now and then, where a former inmate of a madhouse has been dismissed, apparently recovered. Hitherto, moreover, all madhouses have continued to be choke full, so that the multitude of other insane persons who seek for admission into such institutions could scarcely find room in them unless some of the insane in the house died. Not one is ever really and permanently cured in them, a convincing proof among many others of the complete nullity of the non healing art hitherto practiced, which has been ridiculously honored by allopathic ostentation. With the little of rational medicine, how often, on the other hand, has not the drug healing art, genuine, pure homeopathy, has been able to restore such unfortunate beings to the possession of the mental and corporeal health and to give them back again to their delighted friends and to the world. Explanation of footnote 123. It very rarely happens that mental or emotional disease of very long standing ceases spontaneously. This cessation of mental or emotional disease may happen due to internal dyscrasia, due to which mental illness transfers itself again into the grosser corporeal organs, means into corporeal disease. Very few cases are there in which mental disorder have been disappeared apparently. Otherwise, all the mental diseases go on continue. If we name society of mental patients as madhouse, it is always full of its members Any new member can hardly get the room unless any member dies. No one is ever really and permanently cured in them. Though non-healing art allopathic system is practiced and allopathic medicines are titled as rational medicine, which is honored by allopathic ostentation. Many times the truly healing art, genuine, pure homeopathy, has not been able to restore such a mental and corporeal health, unfortunately, and so give them back to their friends and to the world.